Deja, thank you. Okay, 6:30 this morning, we could be a big step closer to a COVID-19 vaccine. The world's largest vaccine study just entered phase 3.
However, we know you still have a lot of questions on what exactly this means for you. So this morning, we're joined again live by Dr. Hawkinson from the University of Kansas Health System. Doctor, as always, glad to have you with us. In your opinion, what is a realistic timeline for when this vaccine could be available to the general public? What's a good thought process on a timeline here?
You know, I tend to be a little bit more, realistic or not as optimistic, but I think a lot of people are saying by early 2021. We know that the government is already pairing with these companies to start creating mass amounts of the vaccine so they can get them out. So it's either going to be early 2021 or I would say even, maybe May, June, which is going to be a little bit later because there still are a lot of steps to go to make that. But I think a lot of the people in the government and health and public health are really thinking early 2021 or just before that they will have even tens of millions of doses of vaccine available.
Doctor, a new poll from the Associated Press shows that really only about half of Americans say they would get a COVID-19 vaccine. 31% of people weren't sure if they would get vaccinated, and 1 in 5 Americans said they would refuse it altogether. So our question for you, since it has been developed so quickly in, relative to what we know about creating vaccines, just to tell people how safe you believe it would be or could be.
Yeah, obviously the first tenet of medicine is do no harm. So when we've heard Dr. Fauci speak about that, the first thing that they're looking at is safety, and that's what those first small trials were. Now, as we move into the phase 3, they are also going to be looking at safety as well, safety and efficacy. So we want to make sure that when we do bring a vaccine to market, that it is going to be safe to people and obviously not cause more harm than the actual infection itself. So the companies, the government is really looking closely at the safety, and even after it's marketed, there will be continual evaluation to make sure that it is safe, that it is not causing more harm. So I think it will be safe. And again, a lot of this technology is not really new. Some of it is older, meaning 10 or 12 years. We know that. We know that you will not be able to get the infection from the vaccine itself. It is just a piece of the virus. So as far as that goes, it is safe. In all of the other aspects as well, it looks to be very safe right now.
So, Doctor, we've talked about looking forward with the vaccine. Let's talk about falling backward a little bit. Kansas City Mayor Quinton Lucas tweeted out a string of warnings yesterday saying he's considering reducing some reopening guidelines because of recent spikes. The governor of Kansas, Laura Kelly, said the same thing, that she's considering moving the state back to phase 2. If we do see this happening on the local and state levels and people start having reverse reopenings, does that help? Will that help to cut into the numbers, do you think?
Absolutely. We know that the mask mandates or the mask rules work if both parties are wearing the mask, if they're out. And we also know that the other issue is large gatherings, so gatherings of 5 or more, or 10 or more. We know that people are going out and having parties. We see pictures and videos all the time of that. We know that there are still a lot of people going out to other areas, such as bars. But it's not only that. We see that the disease spreads in other areas, religious ceremonies, whether it's funerals, birthday parties, other types of religious ceremonies. So it's not really just bars, but it's the overall gathering. It's the gathering of people close together for a certain amount of time without any other masking or protection. If we can address all of those issues, then eventually, I believe we can really either flatten the curve again or stop the spread as much as possible. And that may be something that we need to do in order to stop the overall spread so we can get back to some sort of normalcy. But it does take everybody's responsibility to really decrease those gatherings in those high-risk kind of places and conditions.
Well, judging by Governor Kelly and Mayor Lucas, we could be forced to get back to those mandates possibly sooner rather than later. Doctor, thank you as always for joining us this morning. Dr. Hawkinson, glad to have you.
All right, thank you.
And as you know, Dr. Hawkinson is with us live every Tuesday and Thursday morning on 41 Action News Today at this time, right around 6:30. Be sure to tune in on Thursday. We'll talk to him more and have more questions. If you have questions for us, you can send them to us directly, especially by using Twitter. You can tweet to Lindsay Shively or myself and let us know what you'd like to know.
Absolutely.